The human body is an intricate machine, sometimes producing conditions that are as fascinating as they are rare throughout history. Let's see 9 such unusual disorders you might never learn about anywhere else. Number 1. Fish odor syndrome. Fish odor syndrome, or trimethylaminuria, is a metabolic disorder where the body cannot break down trimethylamine, a compound produced during digestion. This leads to a strong fishy odor in the sweat, urine, and breath. Management involves dietary restrictions to avoid foods high in trimethylamine, such as fish, eggs, and legumes. Joy Milne from Scotland noticed a distinctive smell in her husband, which later helped researchers identify biomarkers for Parkinson's disease. This example highlights the potential implications and importance of understanding such metabolic disorders. Number 2. Uterine didelphys. Uterine didelphys is a congenital condition where a woman is born with 2 uteri, 2 cervixes, and potentially 2 vaginas. This occurs due to the incomplete fusion of the Mullerian ducts during fetal development. Women with this condition might experience heavy menstrual bleeding, severe cramping, and complications with fertility, such as recurrent miscarriages and preterm labor. Hazel Jones from the UK discovered she had 2 fully functioning vaginas at the age of 18, which brought significant media attention and raised awareness about this rare condition. Number 3. Exploding head syndrome. Exploding head syndrome is a sleep disorder characterized by the perception of loud, explosive noises or a sensation of explosion in the head when transitioning to or from sleep. It does not cause physical harm but can be distressing. The condition is believed to be linked to stress, sleep disruption, and anxiety. Many individuals share their experiences on online forums, helping to demystify this frightening but harmless condition and provide support for those affected. Number 4. Epidermolysis bullosa. Epidermolysis bullosa is a group of genetic conditions causing the skin to be extremely fragile, leading to blisters and tears from minor trauma. There is no cure, and treatment focuses on wound care, pain management, and preventing infections. Jonathan Peter, known as the Butterfly Boy, suffered from a severe form of EB. His story brought international attention to the condition and highlighted the challenges faced by those living with it. Jonathan's journey also underscored the importance of research and support for families affected by EB. Number 5. Cotard's syndrome. Cotard's syndrome, also known as walking corpse syndrome, is a rare mental disorder in which individuals believe they are dead, do not exist, or have lost their internal organs. This nihilistic delusion can lead to dangerous behavior, as individuals might neglect personal hygiene or refuse to eat. The condition is often associated with severe depression and other psychiatric disorders. Treatment typically involves a combination of antidepressant and antipsychotic medications. A notable case is that of a patient documented in the Mayo Clinic's records who believed she had been killed by medical staff, highlighting the profound impact of this delusional disorder. Number 6. Hyperthymesia. Hyperthymesia is an extraordinary condition where individuals possess an almost perfect autobiographical memory. They can recall in vivid detail every event of their lives, often down to the exact date. While this might seem like a gift, it can be overwhelming and intrusive, as individuals are unable to forget even the most trivial details. The condition is extremely rare, with only a few confirmed cases worldwide. Jill Price is one of the most well-known individuals with hyperthymesia, having an uncanny ability to remember every day of her life since she was 14. Number 7. Fibrodysplasia ossificans progressiva. Fibrodysplasia ossificans progressiva is a disorder where soft tissues such as muscles and tendons gradually turn into bone, leading to immobility and disability. This process is triggered by minor injuries and can result in joints becoming permanently fused. There is no cure, and treatment focuses on managing symptoms and preventing injury. Harry Eastlack, who became one of the most studied cases of FOP, showed how this debilitating condition can affect one's life. His skeleton is now displayed in the Mutter Museum in Philadelphia for medical research and education. Number 8. Morgellons disease. Morgellons disease is a mysterious condition characterized by the presence of thread-like fibers emerging from the skin, along with sensations of crawling, stinging, and biting. The medical community remains divided on the nature of Morgellons, with some viewing it as a delusional parasitosis, while others believe it has a physical basis, potentially linked to Lyme disease. Joni Mitchell, the famous singer-songwriter, has been a vocal advocate for those suffering from Morgellons, bringing attention to the condition and the need for further research. Number 9. Alien hand syndrome. Alien hand syndrome is a rare neurological disorder where one hand functions involuntarily, seemingly acting with a mind of its own. This can result in the affected hand performing tasks or gestures without the person's control, often counteracting the actions of the other hand. The condition is typically associated with brain surgery, stroke, or infections that affect the brain's corpus callosum. One of the most famous cases involved a patient who had undergone surgery to treat epilepsy, leading to the development of alien hand syndrome. This disorder underscores the complexity of brain functions and the interconnectedness of motor control. So these were the 9 unusual disorder people have. Strange, isn't it? If you like watching such interesting content, don't forget to subscribe to the channel by clicking the right circle and check out another video by clicking on the left. You will like it too.